Hi, this demonstration we're going to look at administering glucagon to a patient. So I've got my CPGs open and I'm just checking. So our patient is unable to swallow safely and we cannot get IV access. So currently we're going to need to give 1 milligram of Glucagon IM. So Glucagon already comes in a kit that is pre-prepared, but we still need to check expiry date. So I've got a Glucagon Hypo kit and the expiry is 03/2032. Could you please check that for me?
Sure. So we've got a Glucagon kit here which has got 1 milligram of glucagon which expires in the 3rd month of 2032.
Fantastic. So we're checking that our seal is on the kit and we're going to open that up. And in our kit we have our glucagon powder, which once again is glucagon, 1 milligram. So this expires in 03/2032. So I have a pre-filled syringe here already, which has 1 ml of saline solution. It is a sharp, so we need to be aware of that. And even though it is a short injection, we are treating it like an IM injection, so we will be using that Z-track method again. Because we're giving it to the patient in the lateral thigh, it's not visibly dirty, we don't need to use alcohol preps to clean the site. Explain to the patient, although they do have an altered level of consciousness, we still need to ask for consent and let them know what's going to be happening. So we now need to just pop off the top of our vial here, and as long as you haven't touched the top you don't need to clean it. We've got sharps exposed, and what we're doing with this sharp is we're going right down the middle of the vial, and if you have a look you can see that there's a little ring there, so we're aiming for the centre of that ring. Once in, we need to then push all of the liquid in whilst holding our finger on the plunger. We're going to shake up that medication till it's all dissolved. If you don't hold your finger on the plunger like this, it will actually already start drawing up. You have to push it back in again and then we can end up with air bubbles. So that's all dissolved. So it's important now that we draw 1 ml back into our syringe. And I'm not sure if you can see that, but the needle is sitting about halfway up the vial, so we need to pull it down so we can just see the tip of it so that we can draw back that whole 1 ml of solution. Okay, so I now have 1 ml there. I'm going to put my glass vial in the sharps and use the Z-track method, so pulling down with my finger, plunging it down. Once again, don't have to draw back. Putting the medication in, and then we pop our sharps in the sharp bin. And that's glucagon.